Good evening. I'm O'Shea Boyd, Public Engagement Editor at the IndyStar. Thank you for joining me this evening. Tonight, we're going to talk about an issue that people feel very strongly about: moving the time an hour twice a year, once in the spring and once in the fall. We just fell back 10 days ago on November 6th, officially ending daylight saving time and putting us back on Eastern Standard Time. In March, we will spring forward to daylight saving time again. Yes, we even have a cute little phrase for this time change: spring forward, fall back. But many people don't think the time change is cute. Ever since we began observing daylight saving time in 2006, I've heard a lot of complaints from a lot of people. So I did a very unofficial poll on my Facebook page to gauge people's feelings, and most were anti-daylight saving time, meaning they don't like switching time. To give a little history, we have former Governor Mitch Daniels to thank for the switch. Daniels said the switch to daylight saving time will boost the state's economy because Indiana time confused those outside the state. Indiana became the 48th state to observe daylight saving time, also known as DST, on April 2nd, 2006, by springing forward an hour. If you remember, the bars stayed open. Of note, 12 counties observe Central Time in Indiana, and those counties switch between Central Standard Time and Central Daylight Time. And believe it or not, they're also debating about daylight saving time in Europe. All this time changing may have an economic value, but it is believed more and more to affect our health. And that's what we're going to talk about tonight. Joining me is Dr. Graham Carlos III,
Hello.
Professor of Clinical Medicine at IU School of Medicine and Executive Medical Director at Eskenazi Health. Welcome, Dr. Carlos.
Thank you for having me.
Thank you for being here. So let's just go ahead and get into it, because I know you have a lot to say about time. So there's this phenomenon called social jet lag. I've heard of jet lag like when you fly from one location to another and there's a time difference, but I haven't heard of social jet lag. Can you explain what this is?
Absolutely. So to understand social jet lag, you need to understand that we as humans operate on 3 different clocks.
Okay.
We have the clock on the wall, or the clock on my wrist, which is kind of our social clock. It's how we make appointments and if we're running on time to an event. Then we have the sun. The sun is obviously in the sky, and we really set our clocks what is high noon based on the location of the sun being directly above you at noon. Then finally we have what's called the circadian clock, or the clock that the body uses to regulate bodily functions like hormone levels, activity levels, that is based on, in part, the sun clock, the second clock. Social jet lag occurs when the first clock, my watch, doesn't coordinate with the other clocks, the sun and the clock inside my body, my circadian clock.
So are the circadian clock and the sun more in line with each other? Humans
have been evolving for hundreds of thousands of years, getting up when the rooster crows and the sun comes up, doing your day, whatever it may be, and going to bed at night as the sun comes down. So as they've evolved and hormone levels have adjusted to those kind of daily norms, our circadian clock has become very closely aligned, or in tune, you could say, with the sun.
Okay.
And so, yes, those two are much more closely related. Ideally, we'd like to pair the clock on the wall, the social clock, with those other two. When we talk about daylight savings and we talk about why people feel tired, social jet lag, it's because there are differences between the 3 clocks. And here in Indiana, specifically Indianapolis, being so far west on the Eastern time zone, our social clock is very misaligned with high noon, or when the sun is exactly at noon. And then when you throw in daylight savings and changes twice a year, things get even more out of sync which is why people feel lousy during time changes.
Okay. Yeah, I don't think I've ever paid attention to high noon, other than like if I'm watching a Western.
Sure.
Now, one complaint I often hear is you can't change time. There are only 24 hours in a day. What you're saying kind of supports that idea that our bodies are regulated with a certain internal clock, no matter what the time on your watch or the wall may say.
Yes, it's very interesting. If you take patients, if you take people who are blind, they have all kinds of trouble getting their clock straight. We know that if we tell them it's bedtime or it's time to wake up, they have a lot of hard time adjusting to those times simply because they don't have the cues visually from the sun.
Okay.
In addition, we know that yes, there are very limited hours in the day, and Americans in general are already sleep deprived because
Yes.
we work hard, we drink caffeine too late in the day, we have blue light coming from our screens. Those of you on Facebook, be careful. And that affects our sleep patterns. So as we try to wake up when it's dark and early and time for work, it's hard because our circadian clock is not seeing the sun. There's no light just yet. The rooster's not crowing. And then when we try to stay awake after it's dark out and your body's telling you to shut down, you feel tired, you feel exhausted. So it's a difficult dilemma when we have misalignment between the three clocks.
So, and I know for teenagers, there's been a lot of talk about time in teenagers and their circadian rhythm.
Oh yeah, the
about
American
school starting so early for high schoolers.
This is a huge issue for parents. I'm a parent of 3 elementary-aged girls, and boy, it can be really, really hard to get them out of bed when it's still dark out.
Yes.
And their bodies are telling you, Dad, I'm not supposed to get out of bed. My daughter Sarah, we have the darndest time getting her out of bed, and she's kind of right. Her circadian clock's telling her, no, I need to stay under the covers, because children in particular, the American Academy of Pediatrics has said they need more sleep than adults. And when school starts early, when school starts in the dark, their hormone levels aren't yet up to par. Their cortisol levels aren't all the way up yet. It's harder to learn, maybe harder to concentrate. You deal with fatigue and these types of things. So that's one group in particular that I worry about with time change.
One of our comments said we need roosters.
That's right. They do a good job. As the light comes up, they wake everybody up on the farm.
The switch to daylight saving time was touted as a good move for Indiana's economy, but we might be paying a steep price with our health. One of the obvious health concerns is sleep, but what are some other health issues that researchers are finding related to switching the time forward an hour and back an hour?
There's 2 big buckets of health concerns. The first bucket deals with the changes. We spring forward the second week of March, we fall back the first week of November, as we just did. During the changes, there is, without question, medical evidence that heart attack goes up, strokes go up, atrial fibrillation, abnormal heart rhythm, the incidence of that goes up. Traffic accidents goes up. There's actually some evidence that people, because they're not thinking as clearly, make poor investment decisions, and the hours immediately
Wait a
following
minute, you mean
one
like
of the time
investing in
changes.
stocks
The
and-
stocks market.
Wow.
That's been shown. You can find these things are easy to find on the
But
internet.
that's not good economic.
And so it's because of the effect on our brains and our thinking.
Where you feel
Specifically,
foggy for a little bit.
you're foggy. The planning and strategy, that's the frontal lobes of the brain, they get affected. But if you're sleepy, you fall asleep when you're driving, and we have more motor vehicle accidents. In our bodies, our hormone levels change. So when you're going through a period where you haven't received as much sleep the night before, your cortisol levels go up. That could induce dysrhythmias with the heart, which can lead to things like strokes and heart attacks and the like. And so there's at least 6 publications in major journals showing increased incidence of the immediate health concern. That's the first bucket. The second bucket is the chronic effects.
Okay.
So the chronic effect of having social jet lag all the time, we see increase in conditions that we call the metabolic syndrome. So this would be increase in obesity, in insulin resistance or diabetes, increase in inflammation in the body, so continuing high levels of cortisol, and also genetic effects, so implications to DNA and how DNA repair takes place in the body. So as humans, we evolved for so long getting our circadian rhythm aligned with the sun clock. And all those levels got fine-tuned. And now here we've changed it all in the last 100, 200 years, where now our social clocks, because they don't align with our body clocks, we've created trouble for the body. And that's why we're here to talk about it tonight.
Now, has there been any studies about, you said the metabolic changes, to see since what has happened, have we become more obese or more diabetes or insulin resistant since 2006?
So the medical studies are very hard to do because it's hard to have a clean control group. So in other words, if you want to do a great research experiment, you would expose half of the individuals to an effect, say changing clocks, and another half you wouldn't, and you kind of compare the outcomes. But there's a lot of confounders making it hard to study. The best data we have is called epidemiologic data. That's just kind of incidence. So hospital admissions, number of billed heart attacks, number of cases seen of a particular disease or condition. That coupled with some research that's growing, this population of literature is growing, it's hard to fund this type of stuff, showing if you check someone's hormone levels the morning after you spring forward and you lose an hour of sleep, their cortisol levels go up. And so that's the other type of research that's being done, where you can look at specific individuals, look at their blood sugar levels. If they're a diabetic, what impact does losing an hour of sleep have? You can do memory testing. You can look at motor skills and fine motor skills. So imagine you're a surgeon and you've lost an hour of sleep. Would you want them operating on your heart?
No.
Yeah. So this is the kind of evidence that's been growing.
And so one of the comments, can you give a quick definition of cortisol?
So cortisol is the fight or flight hormone in the body. So when you see, let's say, a tiger, and you say, I'm going to have to run from this tiger or I'm in big trouble, your heart rate increases, your heart squeezes harder, your pupils dilate, you get ready to run. And so cortisol manifests all those effects in your body. In the morning, cortisol is your get up and go. Cortisol in a smaller scale, but does the same thing. Gets your heart rate up, gets you ready for the day, gets you to the cup of coffee. Then
but
the
cortisol is
takes
not adrenaline.
over. Cortisol is a hormone like adrenaline, but it's in a different category of hormones.
Okay.
So
because when you think, I think fight or flight, I think adrenaline, but it's cortisol.
Also goes up.
Okay.
Yeah.
Learn something new every day.
We're trying.
Thank you.
That's why we're here.
So let's spend a little time on the cardiovascular health, because that is a big deal. As you were saying, there's more opportunities for stroke, heart problems. So let's talk a little bit about that, because that is, we work so hard to try to kind of mitigate heart problems, and then the switching of the time, does it just negate everything you've done?
Boy, it doesn't help.
Okay.
Most of these things are what we call in medicine multifactorial, so it's not just any one thing. But if you're already poorly sleeping, as many Americans are, maybe you already have diabetes or a pre-existing condition, and you're doing your best with medicines and doctoring to control all these things, sometimes it doesn't take much to tip somebody over into that abnormal heart rhythm, into that heart attack or stroke. And so the problem with the time changes is that for many of us, we're getting tipped, we're getting pushed. And that coupled and compounded by everything else is a problem. As we get older and we develop more of these conditions, it gets harder. Before we went live, you and I were talking about how when we were 20, we could, stay up late studying for a test or hanging out downtown Indy, have fun, and be pretty good to go the next day, right?
Yes.
But now you hit 30, and then you hit 40, then you're looking at 50, and you are done at 9 p.m.
Now, I'm not at 50 yet, so let me, give me an hour.
And so your body becomes less resilient.
Yes.
And so then you notice the time change much more. We may have some 20-year-olds watching, they're like, wasted to time change, it ain't nothing. But those of our viewers, you get older, you start feeling things a whole lot more.
Well, and so I guess one of the questions is a lot of this is about sleep. We're focusing on sleep. So isn't the answer just get more sleep then?
Well, not only do we need more sleep in general, but we need better timed sleep. And so that's important here. The time at which you go to sleep Ideally, you want it dark out. You want to sleep 7 to 8 hours, kids or more. And you want to kind of come up as the rooster crows, as the sun comes up. That's going to correlate what's going on hormonally in your body best with, what's going on socially and what's going on with the sun. Unfortunately, many of us, I had to do a number of years working nights and still do occasionally. It's just not possible. So there are some things you can do, and I think we may talk about if you are a night worker, if you do, have a job where, you're working 3 to 11s and you need to kind of get your clock do as best you can to get around that. But in general, getting more sleep is always a good thing. Now, too much sleep, 10, 11, 12 hours, sometimes that can be a bad thing, or it can be a sign of some other health problems.
Okay, so enough but not too much.
Yeah, just the Goldilocks problem, right?
Yes, that is a very good way to put it. So why doesn't the body just kind of fix itself? Since we have this circadian rhythm and...
Yeah, the body, because it's so fine-tuned to the sun clock, to that circadian rhythm, it's very hard to just kind of fix itself. It's kind of a natural process, something that we have very little control over. We can do some things, though, to help the body out. For example, you've heard of the blue light filter for your screens. That's one thing. It's going to be less stimulation to the brain, the parts of the brain that are receptive to light. It can help you fall asleep. Blackout curtains. So this was a huge game changer for me when I was working nights in residency. I would come home after working all day and all night, a 24-hour shift. I'd need to sleep.
Yes.
And I needed that room black, dark, in order to sleep. So blackout curtains help because they cut the amount of light coming in. Diet. So that cup of coffee after 4 o'clock in the afternoon, that Diet Pepsi that someone's drinking right now who's watching, no bueno, because that is going to give you caffeine, which is going to impair your body's ability to fall asleep. There's many other smaller things, and it's definitely worth a look online about things you can do to improve sleep hygiene. So these are ways you can help your body out to try to overcome some of this, but unfortunately they don't kind of totally reset itself back because it's built into your DNA, your hormone levels.
Okay, so we can't fix it with more sleep, but now that we've fallen back an hour and it's dark sooner, it's pitch black outside now. Isn't this a good thing for our bodies then?
Yeah, so standard time in Indiana, and I'm assuming most of our viewers here are Hoosiers right now, so standard time is better because it more closely aligns our bodies with the sun.
Okay.
If we were to adopt universal daylight savings, it'd be a problem. It'd be especially a problem coming up in the winter solstice, which is December. Could you imagine December 21st-ish? It would be 9:02 a.m. before the sun came up. That'd be universal daylight savings.
That's miserable.
That'd be pretty bad, right?
Yeah, that's miserable.
So the idea with daylight savings, I think there's a lot of benefits. I'm a working person who's got to come home, do dinner with the kids, cut the grass. If it's dark out, I can't cut the grass. There's benefits to exercise. I like to jog outside. And if it's dark out, it's more dangerous to go outside and jog. So there are some benefits to what we do now. The point of tonight, though, is hearing about some of the negatives to switching the clock. If we go to universal standard time, so we stay on the East Coast and stop the switching, we eliminate that first bucket, all those switch problems, and we gain some benefits. We don't have to wake up in the dark at 9 a.m. because we'll always be standard time. And we will be more closely aligned with our circadian clocks, our biological clocks. So most all of my colleagues believe that the switching is bad. Many in healthcare believe we should not do universal daylight savings, that we should stay, at least in Indiana, standard time. And you'll find some people that say Indiana should be on Central Time, on Chicago time. No. So that's a whole nother debate.
Yeah, that's a whole nother debate. But again, we have, 12 cities in Indiana that are on Central Time. So
Evansville, Gary.
So we've talked a lot about the effects of changing the time twice a year. much of them negative, as you just said.
Yeah.
Are there any positives that come from
Absolutely. So
from moving this time from standard to daylight?
I think
and
people
vice
might
versa?
be curious to know how we got into this situation, and that's where some of the positives come from. So back around almost 139 years ago Friday will be the anniversary of setting time zones in America. And we did that because railways were needing to coordinate when somebody would be leaving Atlanta and getting into Indianapolis. So that really helped coordination as transportation took off. Then we, around World War I, noticed that in order to save energy and power, we should adopt daylight savings and allowing it to be lighter out later, using more of the sun, so not using so much energy for lights like we have here tonight. And after it was President Wilson, war ended, and he said, no, you know, I want to keep this daylight saving thing because I like to golf, and I want to be able to be president and go home and golf. And so he vetoed when the Congress said, hey, we want to go back to standard time. So he vetoed it. WW2 comes around, they go back to daylight savings, and then it's kind of stuck, and it's federal law. It's federal law, which makes it really hard to change in Indiana. And most recently, Florida introduced the Sunshine Act, which was try to get daylight savings everywhere. It got held up in the House right now. Why? What are the benefits? Why would we do this? Well, one, I mentioned exercise, but there's some others. There's some industries that really benefit, believe it or not, from daylight savings. One is the candy industry.
Wait a minute.
Do you know how the candy industry benefits?
No, I don't.
Oh, I'm glad you're sitting down. Halloween. So we were just trick-or-treating with the girls, and there are some neighborhoods here in Indiana where there are hundreds upon hundreds of trick-or-treaters.
Yes.
And you will have more trick-or-treaters if it's still light out when you're trick-or-treating, which results in turn to all of us filling up our buckets and bins of candy to hand out. So that's one powerful lobbyist is the candy industry.
Wow. For one day.
Yes. But there's a lot of money that's in the candy industry. There are other reasons outside of just candy, though. We mentioned exercise. Another is people who are finishing up your day at home, at work, or at school, and maybe you have a hobby. Mm-hmm. Maybe you want to go out and fish. Mm-hmm. Maybe you want to, I don't know, play with your kids outside on the swing set. There's a lot of kind of benefits to having daylight savings and having that occur, so you have more time outside. Enjoy nature, enjoy Indiana, enjoy a state park, So these are some of kind of the beneficial effects. That's why it's hung up in Congress. That's why we have a debate here tonight, because some people see both sides of it.
Well, and I must say that I am a fan of the whole DST. I like the extra hour in the summer. I seem to be in the minority, according to my Facebook poll.
Yeah.
And according to any informal poll I do, people are very strongly, and if you're against it, you're very strongly against it.
Strong, maybe because they're lacking sleep. That's why they feel so strong.
Because I'm not that strong. I'm not that like strongly for it. I'm just like, I like it. It's good to me. But those who are anti are very, very anti.
I don't like the sun up at 9 o'clock in July. It's hard to get the kids down. It's a little too much. I would like to see us move to somewhere in between. Right now we do 8 months of it. That may be a little too much. Maybe we can find some more common ground. But if I had to pick one thing, it'd be don't do the flips.
Okay.
Let's stick with Eastern here in Indiana.
Yeah, that central time.
Some of your viewers will know that's the good old days. Indiana didn't change.
Yes.
It's kind of a source of pride for our state.
We always have pride about the wrong thing.
Yeah.
You mentioned the Sunshine Act.
Yeah.
So it doesn't look like we're changing our time ritual anytime soon. And there's even discussion at the federal level of the Sunshine Act. Mm-hmm. So can you talk a little bit more about that? And then what are some steps that people can do to mitigate these health issues that may occur?
So the Sunshine Act proposed from Florida was that the whole country would do daylight savings. And this eliminates some confusion. It gets everybody kind of in sync. The problem, especially for places like Indianapolis, is we're so far west in the Eastern time zone that daylight savings, again, the sun's coming up at 9:02 on December 21st. It's bad for Indiana. It's bad for Indianapolis. So it passes the Senate, and it goes to the House. And in the House right now, it's hung up because you have all these representatives, and it's in committees, and it's kind of stalled right now. The issue is that over 20 states have kind of decided they want to do their own thing, which is probably a wise way forward because states are located in different parts of their state in different time zones. But the law is a federal law. And so it's really hard to change federal law. And in the environment that we find ourselves in, it's incredibly difficult. So I'm hopeful that, you know, in the coming months and years, we'll find a way that we can let states be empowered to kind of go their own way and maybe take this out of the federal law category. But I'm not holding my breath.
Okay.
I am losing sleep over it, though.
And then are there any things that we can do to help mitigate any health issues?
Yeah, things. So obviously, we're always going to recommend taking good care of yourself. You know, you exercise, you sleep better. You avoid caffeine late in the day, you sleep better. No screen time late at night, especially phones and stuff.
Oh,
close,
I don't even know what you're saying there.
You're going to sleep better. Hey, if you struggle in the mornings, talk to your employer. You know, maybe you're somebody that needs to come in when the sun comes up. You know, and there's reasons. There's health reasons for that.
Yeah, I'm going to get a doctor's note for that.
I have a couple of my doctors. I work at Eskenazi, and a couple of them I've talked to them, and we've kind of made some changes so that they can, you know, function on the schedule that works best for them. They're going to be more efficient. They're going to be better employees. They're going to be better for their patient.
Yes.
That's what we all want, right?
Yeah, we don't
Nobody
want
wants
that surgeon.
a tired doctor. Yeah, or a
Coming in there
sleep-deprived
sleepy.
surgeon,
No,
right?
no.
So, yeah, and you know, just trying to organize your life and your schedule and just being mindful of the fact that the clock on your wrist is not the clock in your body. So
That's
pay
good
attention to
information.
your body and recognize kind of where you are so that you be mindful of that.
So when we know the time change is coming, should we start preparing our bodies for that? Like, you know how when
Sure.
your children, they've been observing summertime hours,
Yep.
and then you have school coming up, so you're like, okay, we got to start getting ready for bed early. Should we start kind of thinking about this, kind of preparing for the time change?
For those of you that are preppers like that and have the time, the will, and the energy to do it, by all means. But if you're just like a crazy, you know, run from one fire in life to the next, you know, that's hard to do. But yeah, I think if you can do it, do it. The benefits are you don't have the jolt to the system. You don't have that, you know, Sunday morning where you're getting up and trying to get ready for church and you're exhausted because, oh, we had a time change, that's why, right? So if you're somebody that can do it, by all means, go for it so it's not as shocking all to the system.
Okay. Well, thank you, Dr.
Yeah.
Carlos. This
for
has
having me.
been a very enlightening, pun intended, discussion. Good night.
Thank you. Good night, everybody.